Thank you for the generous introduction. Ladies and gentlemen, very good morning to all of you. It is an honor to be here to present my paper. Today I would like to share one of my recent research on Spirulina platensis. This is a microalgae widely used in Bangladesh as anti-diabetic agent. So before move on to my main topic, I'd like to talk about that we learned last 3 days about diabetes and its complication. As you know, it is one of the most challenging public health problem of 21st centuries. If you look at the epidemiology, the prevalence of diabetes estimated in 2000, it is 151 millions, and it is expected that by 2030 the prevalence of diabetes will be just double, more than 300 millions. So it is very alarming. And in Bangladesh, it is 5.7 million people with diabetes. In India, 15 million people with diabetes. The highest number of diabetic patients in Southeast region is in India and Bangladesh. WHO and IDF reports show that the incidence of diabetes is increasing at an epidemic rate, especially in developing countries, probably due to rapidly changing lifestyle, food habit, and environmental condition that we have learned from our previous speaker. So I do not like to go detail. Regarding diabetes complication, as you know, our body is composed of trillions of cells, and the most of them needs insulin to intake glucose for utilization. And diabetes is a state where body is lacking of absolute amount of insulin, that is effective amount of insulin. The defective insulin secretion as well as defective insulin action reduce the absolute amount of insulin that is actually for action. And this, due to lack of effective insulin, the blood sugar is high, the hyperglycemia. This is considered as one of the important culprit for complication. And as you know, in diabetes, almost all organs are affected due to this high blood sugar. And you can see all organs are affected. So this is the complication of diabetes, the macrovascular complication and microvascular complication. I do not like to go for detail. So, the multifactorial pathogenicity of diabetes demands the multimodal therapeutic approach to manage this disease. So a monotherapy, a single therapy not enough. Okay, the current strategies for the management of diabetes, the number one is reducing insulin resistance, which is very common in type 2 diabetes. As you know, more than 90% diabetes are type 2, and they are suffering from insulin resistance. Another strategy is increasing endogenous insulin production. This is only for type 2, because type 1 is lacking of beta cell. Exogenous insulin supplies is mainly for type 1, occasionally type 2. Reducing hepatic glucose production, the another strategy, but the limiting postprandial glucose absorption, this is the newer therapeutic approach and very effective. Because this is recent, if we can reduce glucose absorption in the gut, that you can reduce the burden on beta cell to release more insulin. Because if you continue hammering on the beta cell to release more insulin, then the beta cell will be exhausted, and the release of insulin will be, abnormal and non-functioning. So this is very important strategy for the management of diabetes. Regeneration is still dream. So current therapeutic agents, sulfonylurea, metformin, acarbose, pioglitazone, rosiglitazone, these are have the specific target organ and suffering from adverse effect is commonly hypoglycemia, weight gain, etc. Wikipedia's reports show that no therapy can prevent the deterioration of glycemic control. No therapy can prevent deterioration in beta cell function. Only the metformin can reduce to some extent the macrovascular complication. Few patients achieve HbA1c goal, and 40% required the combination therapy after 3 years. So this is the time to go for to look for more active agent with less side effect. So plant kingdom, this is the area where we can look for more effective drug, as because plants contains thousands of compounds, and of which some may be the hit, may be useful anti-diabetic agents. So this is the blessing of God. So plants has been using in treatment of diabetes for centuries, and till date more than 1,200 species of plant is used in diabetes treatment. So the excellent example of anti-diabetic drug that is plant derivative is biguanide. It is developed from Gallica officinalis. At North-South University, we are working with anti-diabetic plants, the topical anti-diabetic plants. And we have been screened already more than 60 plants as anti-diabetic agent, and that is through bioassay-guided isolation of compound, elucidation of possible mechanism of action, and also we are conducting clinical trial in collaboration with Research Division Bardem and also Chemistry Department of Dhaka University. So this is our achievement. More than 60 plants material has been screened out by our group. Also 150 compounds isolated, and some of the hit compound, these are showed prominent anti-diabetic hypolipidemic activities. This is bioassay guided isolation of compound. We prepared first the crude extract, then go for bioassay, then we go for fractionation and compound isolation, and we repeat again the bioassay, and the active compound is go for characterization, identification of compound. This is series of experiments actually needed for screening of a plant. So we use 3 model rats: non-diabetic, type 1, type 2. For type 1 we use type 1, type 2 diabetic rats we use streptozotocin. For type 1 we inject streptozotocin 65 milligram per kg body weight to adult rat, and after 3 months, after 5 to 7 days, it developed type 2, type 1. But for type 2, we use 48 hours puffs, and we inject streptozotocin 90 milligram per kg body weight. And after 3 months, they are ready for research. Okay, so we use 3 prandial state along with this model rat. This is a fasting and postprandial state. We have simultaneous with glucose load, and 30 minutes before glucose load, because the plant materials go for action and take time. So we use we fed the plant materials before glucose load, 30 minutes before glucose load. So using these 3 model rats and 3 prandial states, total 9 experiments is needed to screen out 1 plant materials, single plant materials. So this series of experiments will help to postulate probable target tissues, probable mechanism of action. For example, if a drug is effective in type 1, it means insulin secretion is absent, or underlying mechanism not involved in insulin secretion, because type 1 is lacking of insulin. If we find the effective in type 2, the meaning is both insulin secretion as well as action may be involved, because type 2 having some beta cell to release insulin. Okay, so using these 9 experiments, we have screened out 60 plants by our group, and these are the list of plant material. Just to this is 60 drugs we collected from India, Pakistan, Bangladesh, and the surrounding countries. And based on the probable mechanism of action, we classified these plants into 3 subclasses. Like these are the drugs listed here, enhance or promote insulin secretion. These are the plants inhibited glucose absorption in the gut. These are the drugs, they showed effect on peripheral tissues, like increased glycogen content in liver muscle. Okay, for detailed mechanism of action, we use 2 types of experiments. One is to assess the pancreatic action, and we use perfused rat pancreas, that is pancreatic perfusion technique. We use isolated islet from rat. We use Brin BD11 cell line, this is insulin secretory cell line. For assessment of extra pancreatic action, we use in situ gut perfusion technique to study the glucose absorption. We use enzyme activity, the disaccharides enzyme activity. Also, we determine liver glycogen content. Okay, so using this series of this series of experimental techniques, we studied underlying mechanism of action. So, Spirulina platensis, this is my recent work, and as you know, Spirulina is a macro algae that has been consumed for centuries because of its nutritional value. It is a source of protein, vitamins, and minerals. It has an anti-cancer, antiviral, and anti-allergic effect. This platensis is the most widely used traditional agent for diabetes management in Bangladesh. So the extract of platensis showed significant anti-hypoglycemic effect both in diabetic rat and in human. This is in our primary screening program. With these 9 experiments, we found that this platensis can reduce blood sugar at fasting state as well as postprandial state. Okay, so we can postulate that this effect at fasting and postprandial state indicates that it might have effect on insulin secretion and as well as insulin action. So we designed some experiments for both the insulin, for the study of insulin secretion as well as insulin action, to get the detailed mechanism of underlying anti-hyperglycemic effect of this LJ. Okay, so for assessment of pancreatic action, we use whole pancreas, that is pancreatic perfusion, isolated perfused pancreas, and also isolated rat islet. So the pancreatic perfusion technique is a useful tool for anti-diabetic research. We use this. This is totally surgery. It takes 2 hours. Pancreas is isolated with a proximal portion of duodenum and separated from intestine, stomach, and spleen through surgery. And pancreas is perfused with extract fraction, with or without glucose, and it is passes to the cannula inserted in abdominal aorta, and the effluent, the perfusate, is collected from portal vein, the cannula inserted in portal vein, and the rate of perfusion was 1 ml per minute. So these are some slides of the surgery. So before the experiment, or before the administration with the extract, we go for the control experiment to see, in order to confirm that the tissue retain normal secretory capacity during the 90-minute experimental period under this condition. So before test with drug, we go for the standard curve, or in this case we use 11 millimole glucose and arginine to see whether this 70 or 90 minute duration of the experiment, the tissue can retain the insulin secretion, the capacity of insulin secretion. So as you see, with 11 millimole glucose, the almost 30-fold raise in insulin secretion compared to basal, and with 19 millimole arginine, it was 3-fold as compared with the glucose. So this is the control experiment. We done it before the experiment, and with this extract, we found that the extract increased insulin secretion 10-fold above the basal, and when we treated with 11 millimole glucose with the extract, it is raised insulin secretion or stimulated further insulin release. So when we tested with 5 fraction of the same extract or same LG, we found that 3 out of 5 extract or the fraction, the ethyl acetate, butanol, and aqueous part, increase insulin secretion more prominently, and in presence of 11 millimolar glucose, it increased further insulin secretion. Okay, so for detailed mechanism underlying insulin secretion, we use 3 drugs, that is diazoxide, verapamil, and theophylline, to look at the channel, whether the ATP sensitive potassium channel or the calcium channel involved or not, whether the cyclic AMP is involved in its mechanism of action. So as you know, normally in our body, insulin secretion is actually via the normal metabolic pathway with glucose metabolism. And when glucose is metabolized to ATP, then ATP close down the ATP sensitive potassium channel. Then cell membrane is depolarized and calcium channel is open. So calcium enters the cell, which triggers exocytosis of insulin secretion. So in this case, diazoxide inhibit the potassium channel, so reduce the insulin secretion. Verapamil close the or inhibit the calcium channel. So calcium cannot enter the cell and reduce insulin secretion. So if we find that the extract can inhibit further the action of diazoxide and verapamil, it means that potassium, ATP sensitive potassium channel and calcium channel involved in its mechanism. Also, theophylline is the inhibitor of phosphodiesterase enzyme, and you know this enzyme is important for conversion of cyclic AMP to AMP, which is totally inactive. So theophylline inhibit this phosphodiesterase enzyme. The action of cyclic AMP is increased. So if the extract can potentiate or increase action of theophylline, meaning a cyclic AMP is involved in its mechanism. So we use these three drugs for the study of mechanism underlying insulin secretion. So when we use diazoxide, as you find, the extract cannot reduce the action of diazoxide. This is diazoxide. And when we use verapamil, verapamil as compared with the extract and extract with verapamil, it cannot reduce the insulin release or insulin releasing action of this extract. When we use theophylline, it enhances the action of insulin secretory action as compared with without theophylline. So possible involvement of cyclic AMP is in its mechanism. So we can conclude that platensis has insulotropic action both in basal and glucose stimulated state. The extract stimulated insulin secretion through metabolic pathway by enhancing glucose stimulated insulin secretion and inhibiting ATP sensitive potassium channel. Calcium channel is not involved in the mechanism underlying insulin secretion. Cyclic AMP might be involved in the insulotropic action of the extract. Also, we check the insulin secretory action in isolated islet, and we found that extract as well as two fraction, the ethyl acetate and butanol, increase insulin secretion in isolated isolated islet. So, as you know, in our primary screening, we found that the platensis showed hypoglycemic activity is in postprandial state in type 2 diabetic model rats, so which indicates that the extract may interfere with the absorption of glucose in the gut. So we designed 3 experiments in the gut to see whether it has got any effect on absorption of glucose in the gut. So we use in situ gut perfusion technique, and also for extrapancreatic action we use liver glycogen content. As you know, the glucose postprandial hyperglycemia that we learned from your lecture, that it is very important. The postprandial glucose is a very special problem in diabetes mellitus, as because we do not like the peak. So after meal we have peak, and this peak actually is responsible for complication. So the inhibition of glucose absorption from the gut offers a potential therapeutic approach in the management of diabetes. So we use in situ gut perfusion technique to study the absorption of glucose in the gut. We inserted a cannula in the upper duodenum, and the perfusate was collected from end of the ileum, that is just before cecum. So I can go directly to result. So during 30-minute perfusion with glucose, there is no change. Okay, so we selected 30 minutes for this study, and the extract supplemented with glucose solution was decreased significantly during the whole perfusion. So glucose absorption was inhibited in the gut by the extract. So we conclude that anti-hyperglycemic activity of platensis is partly mediated by inhibition of glucose absorption in the gut. Also, we studied whether the gut enzyme is involved in its mechanism, because digestion of carbohydrate in the gut is also important for absorption of glucose, that is the end product. So if we can slow down the digestion process in the gut, we can slow down the absorption of glucose. And when the glucose is slowed down in absorption, it can be flatten the glucose in blood level. So we can avoid the peak. So it is very important. We use sucrose. And because if we use sucrose, then it can be involved digestion as well as absorption. When the extract administered along with the sucrose in the gut, and we isolated this 6 segment of this gut, and we found that in every segment the glucose, that is the digestion of sucrose, or the glucose absorption was decreased, or remaining sucrose was increased in the gut. So it means the extract can inhibit probably digestion of carbohydrate in the gut. We check it with disaccharidase activity. We extracted this enzyme from gut and incubated for 1 hour, and with the extract, and the conversion of glucose is estimated, and the disaccharidase enzyme activity was calculated from the glucose converted from sucrose. And we have seen that platensis can reduce disaccharidase activity in non-diabetic rat. So we may conclude that anti-hyperglycemic activity of the plant partly related to inhibition of carbohydrate digestion by inhibiting disaccharidase activity as well as absorption of glucose in the gut. Okay, this is the last slide, that is liver glycogen content, and we have found that the extract can increase the liver glycogen content in type 2 diabetic rat. This is probably due to a stimulation of insulin release from beta cell. So in summary, we can say the rapidly increasing prevalence of diabetes throughout the world will continue to challenge the existing therapies, and thus encourage new approach to encounter to counter the diabetes mellitus. The present study has evaluated the potential anti-diabetic activity of platensis that is used in the treatment of diabetes, and it is hoped that this revelation may provide a starting point for identification and characterization of innovative therapeutic agents. The continuous research is recommended to elucidate the pharmacological activities of plant-derived remedies that is used for treatment of diabetes. So this is our campus, North-South University. Some labs, the analytical labs, analysis lab. This is pharmacology lab. This is our animal house. So in this last slide, I'd like to acknowledge my students, especially the Parvez Ansari. He is from Nepal. He is my research student. So thank you very much for kind patience.
Thank you very much. Just one question. When you extract a compound inside, or you simply mash the plant and you give that? How do you give that?
Oh, this is ethanol extract. Yeah. Then we go for partition fractionation with hexane, chloroform, ethyl acetate.
Oh, I understand the method, but you consider that you able to pick up the active compound, or you just
we need further, research.
You give that to the rat by eating or by injection?
Orally feeding, mostly, but some technique like pancreatic perfusion. This is through the aorta or the artery, like this.
Question?
There's some comments and one question is that this is a nice approach, because from time immemorial in Ayurveda and whole system we have been using herbal preparations and all, but very less effort has been done to elucidate and scientifically prove this type of random experimental studies and then further in clinical trials and all. So that's why what is happening that there are numerous potentials, but things are not being elucidated and has not come up in the market, or drugs only we are depending upon all the chemically synthesized or insulin. It's a nice approach for doing that. Only one thing I was wondering about that, you have talked about theophylline and phosphodiesterase. Only one my concern is that there are umpteen numbers of phosphodiesterase in our body. So you cannot say that like phosphodiesterase in the lungs, phosphodiesterase in the other cardiac heart, phosphodiesterase in the other tissues, because had it been theophylline inhibition, phosphodiesterase in the lungs, same does not work in the heart and same does not work in the other tissues, because different type of phosphodiesterase enzyme is there. So I wanted to tell you that once you extract it, the active ingredient, as Dr. Dorian is telling that, then you will be able to tell it definitely that whether it works on phosphodiesterase inhibition or not.
Okay, just I can address some of this point. That is, for plant materials, I recommend not to go for pure compound, because there are lots of compound there. Some has got synergistic effect. Some can reduce toxic effect. Number one. Number two is theophylline is used only to check the which channel is involved in its mechanism, not for other action. So theophylline is phosphodiesterase enzyme inhibitor. So whether cyclic AMP is involved in its mechanism, because we use many experimental techniques for the study of plants. Usually these techniques not used in plant materials study. Is used other physiological, pharmacological experiments. But I try to use this modern techniques in plant materials study. Okay.
What you conclude from these studies is that mostly the material, the compound, act on slowing the digestion of glucose, right?
Yeah.
So one question was, does it increase the insulin secretion? This was one question. The other one, does it slow the ingestion and digestion of sucrose? But there is another question that you were thinking about it, but I didn't see that you did, is insulin sensitivity. You could do it with the clamp technique just to see if it works also on the periphery, which is also important because there are many plants, at least in Israel, that are used for diabetics and they work, that are mostly working on insulin sensitivity. So are you going to try to see if it works also on insulin sensitivity in your type 2 model of rat? That means they have diabetes, but you can put it down, your glycemia, take it down just because you increase the insulin sensitivity. You can do it with clamp technique.
Basically, it's insulin action. I tried to measure glycogen content in liver. This is insulin action. Another thing is type 2 diabetes with streptozotocin.
Yes.
So if we use at the same time sucrose, then the insulin resistance you can accommodate.
Okay. And another question, that how it is used in the population, the spirulina, how they use it in the everyday life, just for disease, or they use it as protein source?
It is just immunity booster. In our country, people are taking this, even is in prepared form, in capsule form, because it contains, is a very good source of protein, minerals, vitamins. So people are taking this, and
as supplements.
Yes,
as supplements.
And also the diabetic patient, they are taking this. So
okay.
For a long time.
Yes.
Well, Dr. Hannan, it was a very interesting presentation because experimental medicine is very sparingly discussed in international fora. Mostly clinical topics are given more attention. But I would like to correct certain things. Number one, the figures quoted for India as far as diabetic patients are concerned, the right ones are, currently we have 70 million diabetes patients. I think you quoted 30. What was your quoting?
15 million?
Anyway, the two less. It is 70 million as per as 7th Atlas of International Diabetes Federation.
Probably it's not the recent.
No. Most authentic figure is 7th Atlas of International Diabetes Federation, and that quotes current figure as 69.9, that is about 70 million. And the world population currently has 384 million diabetic patients, which is expected to be 550 million by 2035. You had quoted only 300 probably.
It is projected, if you projected it by 2030.
No. What was the source of your information? It was about 50% of the correct figures. So number one.
Probably it is the source.
But I have told you the
WHO.
source, 7th Atlas of International Diabetes Federation, most authentic document for these figures. Secondly, in your list of anti-diabetic drugs, you had forgotten two groups, gliptins, then GLP analogs. Gliptins, I mean DPP-4 inhibitors, then GLP analogs, and then SGLT2 inhibitors. These three groups are completely omitting. You are not gone beyond.
In pipeline.
These are there. Yeah.
It's still pipeline.
No. What are you talking pipeline? At least 5-6 molecules are available in each group.
Analog already in the market. But
No. I am talking about SGLT2 inhibitors, dapagliflozin, canagliflozin. They are omnipresent everywhere. So number one, that was omission.
My target is not that. Just to say they are suffering from side effects.
Third.
That is my message.
My third comment is,
yeah.
Your comment as far as the UK PDS is concerned is outdated, that diabetes is a chronic progressive disease. Now the era is that of cure. It is shown that even 23 years old diabetic patient can be reversed. And I will quote Roy Taylor. He is from New Guinea of UK. He has shown that by hypocaloric diet, if you can reduce even 1 gram of fat from pancreas, you can cure diabetes. So diabetes is no more regarded chronic progressive disease. This is a very rosy picture of the diabetes. No more to be very sad about diabetes. It is a curable picture. Then I tell you my own research, which I presented in American Diabetic Association in 2012, partial reversal of diabetes. Roy Taylor speaks of a very, very drastic plan. He says 400 to 600 calories per day. And that too are given through 3 milkshakes. And the patient has to be admitted because of the electrolyte imbalance, etc. So patient has to be admitted. So I always go midway and a very simpler approach. The simpler approach was just half the diet.
Yeah.
And your caloric content will be around 10,000, 1,000 to 1,200. And by that 33% HOMA IR can be reversed. And that too, I can say, I have cured diabetes by 33%. This is my approach. I am going to present it in Berlin, again, Omics conference. I am the first speaker in that conference. First day, first speaker.
Okay, thank you very much.
But I think the presenter was presenting this effect of the plant.
Yeah, it's a different angle.
But thank you to proceed.
In one of your experiments, you showed that if you give arginine, you have a much higher increase in insulin infusion, right? And insulin secretion. That's the area under the curve was absolutely significantly higher than if you infuse
Glucose.
Yes.
11
and in your spirulina, there is a very high content of protein. Do you think one of the protein is one of the amino acids in the spirulina is having some effect?
Yeah, I got your point. Basically, we use arginine in control experiment. We did not use this, in main experiment, this arginine. This because arginine is highly potent insulin secretory drug. So arginine is used at the end of this experiment to see whether the tissue, the pancreas, retain the normal secretory capacity. Just for that. Okay. It's not in the experiment.
Okay. Thank you.
Another mechanism is arginine gives rise to nitric oxide inside the body.
It's a very potent one.
Yeah.
So the nitric oxide,
It's an insulin secretagogue.
the mechanism of insulin secretion, but the major effect of arginine is because the cation is a positive cation. So it's an action to depolarize the membrane.
Yes.
So the major effect of arginine is that. And it's why probably when you saturate too much the depolarization of the membrane, you probably saturate the mechanism of insulin. If you added polyethylene on that, it will simply tell you that's another mechanism of polymerization. I think we'll stop here. Very interesting talk, and we'll go for the coffee break.
Thank you very much.
Thank you.